Have you been told you need to stop doing what you love, whether it's exercise, running, or a sport? Well, here at Dynamic, we don't like that answer. In this podcast, we'll talk to leaders in the health and wellness space from Southwest Florida to get the solutions you need to get you back to doing what you love. Welcome to the Dynamic Naples Podcast. Hey, what's going on? Dr. Chris here, and today I want to talk about lifting with a flat back and does it matter? I was with one of my buddies the other day, and he's a big time workout guy. He's in great shape, and we were talking about deadlifting. He said, it's all about lifting with a flat back. And I said, well, that's not 100% true. And the short of it is, it only really matters if it matters. Now, what does that mean? It's to me, it's a lot like posture. Posture. Some people can sit a whole career with a banana back rounded, and never develop pain and be fine. And others may develop pain. So, for the person that develops pain, then they probably should do something to address that. I think part of that too is what are your goals and what are you doing outside of life. So let's take somebody who's sitting at a desk 40 years. And, they don't really do much outside of work. They go home and have a bit of a sedentary lifestyle. They're probably going to be okay. But then if the next person that's been sitting there for 40 years likes to do CrossFit and lift things overhead, well, that position that they've gotten used to not as a rule, but can limit your overhead mobility. So by doing something that requires a lot of overhead movement, it may expose they have a limitation. Or if you take the person who is mostly sedentary, maybe they've developed some lack of overhead mobility. They never notice it until they have to go travel. They lift some luggage overhead and they get shoulder pain. And then it exposes that limitation. So that person may have been good, no pain, sitting on the couch for the rest of their life. But as I like to say, well, it's not my quote, someone else's, a ship in port is safe, but that's not what ships are meant to do. So why does this happen? Why do these adaptations occur? Well, your cells of your body, all your cells are constantly turning over, right? Which is a good thing. Right? Like a snake that sheds skin, you want to keep replacing all of your cells. And those cells, the signaling to them and how they grow and mature depends on the stresses you place upon it or don't place upon it. That's what's called Wolff's Law. More on Wolff's Law later. So if you are in this sort of slumped position all the time, the angles that your muscles sit at, the skin, the fascia, all the connective tissue, they develop in that position. And most likely once you introduce load, that will probably accelerate the adaptation. And let me just clarify that. So if you're on the earth and in gravity, there is always load. It's just the more you increase the load, likely the faster these adaptations will occur. We need load. And if you're in space and there's no load, you developed severe osteoporosis because that's how our body's developed. We need the stimulus of load. So let's get back to the deadlifting and flat back thing. So where does this all come from? Because you still hear it perpetuated like crazy. Tons of coaches say it. I've heard physical therapists say it. And I just, I have some qualms with it because I think it induces some movement phobia. So Stu McGill was a researcher from Canada, and he wrote several books. And he studied pig cadavers. He studied the spines of pig cadavers, examined the pressure within the discs. So this is what we're talking about, the intradiscal pressure, and found that with repetitive movement, repetitive spinal flexion, aka bending over, rounding the back, makes the pressure in the fluids in the disc, the nucleus pulposus, makes it push backwards where there's the potential for herniation. Now, keep in mind, these are pig cadavers, so they don't stand the way we do. They stand horizontally. And this is dead tissue, cadaver tissue, so it's not going to have the same ability to adapt. It's not going to have blood flow. It's not going to have oxygen. It doesn't have all things that we have when we're alive. So a lot of conclusions were drawn from some of these studies, and then the sort of the fear of bending over began, and a lot of researchers came out. And let me just back up and say, I read Low Back Disorders, one of Stu McGill's books. It's great. There's a lot of great lessons to be learned. So in no way, shape, or form am I trying to say anything bad about him at all. I just think some of the conclusions that came out of the research, we'll say they are overrepresented. A researcher in the late 70s and 80s, but named Nachemson, came out with kind of finding the same stuff and came out with a chart showing different disc pressures based on your position, laying down versus standing versus bending over. And therapists, including myself at one point, were handing this out saying avoid these positions. Fast forward a few decades, and you've got a whole culture that's afraid to bend over to pick up a pencil from the ground, especially if they've had any back pain. So what is the fear? The fear is that you may herniate the disc, so the fluid pushes out through the annular ring, which is very thick fibrous tissue, by the way, and then that can press on a nerve and give you sciatica or radiating pain down the leg. But there's other things that can do that too, like stenosis or any kind of narrowing between the vertebrae, which what stenosis is. That would usually occur with repetitive extension, so leaning back. So what we're left with is staying in this neutral position at all times to avoid any pain. Now, first of all, pain is part of being human. Pain does not necessarily mean damage or injury. Typically, pain will precede injury. It's more of a warning sign to say, hey, careful, that was a bit too much. So we shouldn't fear pain. We should respect it, just like cold, right? Cold is just, or hot, just another sensation that says, okay, my tissue can tolerate this much. Any more, there may be some damage that occurs. And let me also point out that the majority of the time, a herniated disc can heal. And the majority of the time, a bulge disc does not even cause pain. What I see happen constantly is you have somebody, maybe they're lifting something heavy and they experience some pain. They freak out because of all this movement-induced phobia. They go see their surgeon or their MD and they get an image. They find a bulge disc, which is a very common finding, by the way. And then they say, oh, that's the problem. Stop deadlifting, or you might need surgery. And I can't tell you how many times I've seen that, and it's just a acute flare-up of a muscle. There's a muscle called a QL, or your retrospinae, or your lats. They all are involved in a deadlift, and sometimes they just don't handle, or they're not prepared for the load. Let me say it that way. So that's what I'd say. Almost all injury, outside of acute trauma like a bullet wound or being stabbed or something like that, outside of that, the majority of issues that arise from the musculoskeletal system are the tissue wasn't ready for it. Right? This is weekend warrior syndrome. This is, I've been working for the past 3 decades, and now I decide I want to pick up pickleball and play 7 days straight. Well, okay, you can't go from 0 to 100 and expect nothing bad to happen. Or you get some ego lifting. I saw one guy who used to be in really good shape and used to curl 40-pound dumbbells and got away from it for a couple decades. Worked in finance, was sedentary. Then he was like, that's it, I'm gaining weight, and I need to start curling for whatever reason, as if that's going to make you lose a lot of weight. And picked up the same 40-pound dumbbell like 30 years later, and he tore his bicep tendon. Progressive overload is the name of the game. Your body will basically respond to any demand you put on it if you do it in an intelligent way, meaning progressive over time. It's a marathon. It's lots of reps, slowly loaded over time. So you may have heard of a Jefferson curl. That's basically a deadlift with a rounded back. Now, people have been doing the Jefferson curl for many decades. There's a guy named Bob Peoples. I Google him. He was like a farm boy who lifted crazy amounts of weight, had all kinds of records, lifted completely with a rounded back. His discs never popped out the back of his spine. But he was probably, or he definitely was, had the capacity of his tissues to handle that volume. So where does that leave us? So lifting with a rounded back, or an extended back for that matter, is probably okay as long as you prepare for that. You do that slowly in a smart way. I will say, caveat here, if your back develops a sensitivity to too much flexion or too much extension, that may be the time to now lift with a neutral back, is whatever that means, because it's kind of near impossible to have a perfectly neutral back. But you may need to temporarily do a more neutral position until everything cools down, and then I would want you to get back to getting some spinal flexion and extension. In fact, I would argue that's probably a really good idea to train the spine in multiple positions so that when you go and just do life, be a human, and you pick up something without thinking about it, maybe heavier than anticipated, your tissue is prepared for that and nothing bad happens. I think a lot of practitioners hear on a regular basis, I bent over, I picked up something heavy, or I was deadlifting, and now my back hurts a lot. And if you hear that repetitively and you're not really thinking about it in these terms, it's easy to say, okay, well, deadlifting's bad for your back, don't do it. Well, I would say your back hurts because you don't deadlift. There's kind of an old school thought that, you should strengthen your core for your back, right? Well, you should strengthen your back for your back. I think that makes way more sense. In fact, there was a study that came out that found a high correlation between fatty infiltrates on an MRI and low back pain, meaning when they looked at the paraspinal muscles, the muscles that line the vertebrae, the more fat, or in other words, atrophy they had of the muscle, the more likely they were to have back pain. So almost all of my patients that come to me for back pain, we don't start with deadlifting, but we definitely end with it. By the time they're leaving the clinic and they're out of pain, I'm getting that back strong so it doesn't come back again. So what about degenerative disc disease? I know you're thinking that, right? Okay, so you're saying you can round your back, you can extend it. If it herniates, it probably will heal. What about the disc height? Okay, so the research on this is all over the place. Some studies have found that deadlifting or lifting or powerlifting in general decreases disc height. Others have found just the opposite. I'm looking at one right now that reads, let me read the conclusion here. The disc called Prevalence of Degenerative Vertebral Disc Changes in Elite Female CrossFit Athletes, a cross-sectional study, which is a high-power study. Asymptomatic female elite CrossFit athletes do not show an increased prevalence of degenerative disc disease. Compared to a sex-matched control group, high training volume in CrossFit does not correlate to a higher incidence of degenerative disc changes in young females. Now, this is just one of millions of studies. There's tons of stuff out there. So we don't know if load decreases the disc height. We do know that fluid matters, so dehydration probably is a big part of that. We also don't know is disc degeneration necessarily bad. It certainly has that connotation just because of the name of it. But what if that's an adaptation? Maybe there's some sort of benefit to having a smaller disc. Maybe that's repetitive adaptation as opposed to disc degeneration. I think if it was just called something different, maybe we'd be thinking about it differently. People who swim develop stiff lats, and that's a positive adaptation for them. Runners, basketball players develop stiff Achilles, and they become more elastic. The recoil is better for the Achilles, so that's a positive adaptation for them. There's a trade-off for just about anything. They may develop limited ankle range of motion, dorsiflexion in particular, but maybe that's a trade-off for being a little faster, jumping a little higher. But let's just say, for the sake of argument, that degenerative disc disease is bad. Let's just say that it definitely is. We don't know if powerlifting, deadlifting increases or decreases disc height. In fact, we don't know if it has something to do with something non-mechanical at all. And there is some evidence of that. I've been talking about functional medicine a lot lately and studying the gut microbiota, and there's a lot of evidence. I think I posted in one of my recent podcasts 8 different articles that point to the diet and chronic inflammation causing the breakdown of cartilage in joints. So that we used to think, too much wear and tear breaks the cartilage down, and then you get bone on bone, which I hate that phrase, and that triggers inflammation. Well, now we're finding it's just the other way around. Inflammation, chronic inflammation from a gut dysbiosis. And why do they know that? Because the same pathology in the gut, the same bacteria, has migrated to the joints, and that is causing inflammation in the joints, and that inhibits the progenitor cells, which are the cells responsible for turnover of cartilage. So there is already some preliminary evidence that diet and chronic inflammation play a role in the breakdown of cartilage, and there's also the same thing with the disc. So here's a study that came out in 2022. Now I'll say that the gut microbiome is still, we're to the tip of the iceberg. Still so much to learn. So, take this with a grain of salt. But there is so much evidence coming out of this. And Hippocrates did say all disease starts in the gut. And I think he was right. Personal opinion. But, okay, here's a study. 2022, gut disc axis, a cause of intervertebral disc degeneration and low back pain. So I'll just kind of read a bit of the abstract here. Low back pain, a widely prevalent and costly disease around the world, is mainly caused by intervertebral disc degeneration. Although numerous factors may trigger this degenerative process, microbiome dysbiosis has recently been implicated as one of the likely causes. And they go on to say that, of course, future studies on the microbiome, fungi, and viruses in intervertebral disc disease is necessary to revolutionize our thinking about their possible role in the development of IVD diseases. They go on to call for more research, as what research always does, on gut microbiome and viruses and how it may trigger inflammation and inhibition of the intervertebral disc. So we don't know if heavy lifting improves disc height or negatively impacts it. We don't know if disc degeneration is necessarily bad. It could be a positive adaptation. We don't know if diet and lifestyle changes may affect the disc degeneration. There's been tons of lifters in the past that have done a lot of rounded back lifts without herniating discs. And we have a culture that's afraid to move their back and therefore have developed a bunch of weak backs. So I am of the opinion that we need to strengthen our backs for sure. Maybe that means starting in neutral, right, playing a little bit on the safe side, and then progressively load that and progressively start to train other positions to back as well. And I did say play on the safe side. I almost want to retract that. That's sort of the old therapist in me talking. I think that mindset it's dogmatic and it needs to go away. You are human. You're supposed to move. Your spine is supposed to bend. It's supposed to twist. It's supposed to extend. That's normal human behavior. If you shouldn't flex your back at all, then you shouldn't get out of bed. It doesn't even make sense. I even read a study somewhere that the military has stopped doing sit-ups because of fear of herniated disc. I mean, this is the level of fear it has induced on the societal level. In fact, I've seen a lot of patients with back pain from stiffness, and maybe it's because they're just not moving their spine at all, or minimally at least. Okay, I think I've beaten the dead horse. I think I'm ready to end this rant. So the bottom line is there are no bad movements. There are only movements that you were not prepared for. Become resilient and prepare your body for all positions. Why guess when you can test? Do you get hangry or crash after a carb-heavy meal? These could be indicators that there is a dysfunction in your blood glucose regulation. If left unchecked, it can lead to irreversible changes. If you catch it quick enough, you can make diet and lifestyle changes that will get your levels where they need to be. 88% of Americans are pre-diabetic and don't know it. Diabetes underpins many of the pathologies we deal with in this country, such as obesity, high blood pressure, heart disease, and stroke. For some reason, it is rarely screened with your physician, and if they do test for blood glucose, it's usually with an A1C or a fasting glucose, which can sometimes give you a false negative. NutriSense is a company that supplies continuous glucose monitors. We paired with NutriSense to get you real-time data to see how your physiology responds to glucose. The NutriSense app lets you track your daily activity to see how food, sleep, exercise, and stress impact your glucose. You can log or import this data into the NutriSense app to see the effect on your blood glucose levels as soon as it happens. Use the code DrChris25 for $25 off your order today. Do you have unexplained pain, or do you wonder just how healthy you are? When was the last time you had your blood tested? Blood chemistry analysis is a great tool to stay ahead of any health conditions, and now you can have control of your health with Let's Get Checked. Let's Get Checked is an incredible company that sends blood tests to your home. You can choose from over 30 different tests, whether that's thyroid function, testosterone, micronutrient, cholesterol, or C-reactive protein, which is a marker for inflammation. It is sent to you with free shipping, and you get your results in 2 to 5 days. No physician referral needed. Use the code DPT25 for 25% off. You can find links in the show notes. Did you know that you can get started with physical therapy without a physician's referral? Physical therapists don't just solve pain, we get down to the root cause and keep it from coming back. We also discuss all things health, such as nutrition and lifestyle changes. If you feel that you could use some help, let's get on a free consult call. Go to www.dynamicnaples.com and sign up for a free call. Also, if you like this podcast, please give us a rating wherever you listen to podcasts. It helps us spread the message. Thanks for listening, and we'll see you next week.